Hello friends, today topic is NHM staff nurse exam question paper with answers, detailed explanation and also key answers key. Before moving to topic, small suggestion friends, please subscribe my channel. Then the first question is the component of vital signs. Here first question is vital signs. The first and foremost thing, the main role of nurse. A. Temperature, pulse, respiration and blood pressure. B. Temperature, pulse, respiration and blood pressure. C. Temperature, pulse, blood pressure and D. History taking. Vital signs means temperature, pulse, respiration, blood pressure will come here. The answer is B. As a nurse, the role of nurse, we have to check first and foremost thing. If one patient is came to hospital with some complaints, as a nurse, the role of the nurse, first role is checking of vital signs. This is the answer is B. Temperature, pulse, respiration and blood pressure friends. Next, move on to second question. The second question is, in hyperpyrexia, the body temperature is, means here they asked what is the body temperature when patient is having pyrexia. A. 103 Fahrenheit, B. 104 Fahrenheit, C. 102 Fahrenheit and D. 105 Fahrenheit above. Actually, pyrexia means fever. Here they asked hyperpyrexia. Hyperpyrexia means normal temperature is 98.6. Here hyper means more, 105 is the above 105 is the answer. Answer is more than 105 Fahrenheit. The third question is the temperature required for autoclaving. Autoclaving means one of the sterilization method. A. 150 degrees Celsius, B. 121 degrees Celsius, C. 160 degrees Celsius and D. 112 degrees Celsius. The answer is 121 degrees Celsius. 121 degrees Celsius. Autoclaving is one of the sterilization method using in hospitals most commonly. It is approximately 15 to 20 minutes. Autoclaving timing duration is 15 to 12 minutes. 15 to 20 minutes. It is one of the sterilization method. The fourth question is highest total score of Glasgow coma scale. Glasgow coma scale highest score. Here options is number A 5, option B 15, option C 10, option D 20. Actually here we can see the picture. This is the Glasgow coma scale. Actually normal is total range is 15 friends. Normal is actually minimum score less than 3. If patient is getting less than 3 Glasgow coma scale score, if that patient is unresponsive or patient is undergone coma, that is the use friends. Actually Glasgow coma scale we will use for checking eye opening, patient eye opening and verbal responding and motor responding. The normal is 15. Answer is B. Minimum is score 3. The fifth question is nosocomial infection. What is nosocomial infection? A. Household infection, B. Hospital acquired infection, C. Waterborne infection, D. Airborne infection. Actually nosocomial infection is a hospital acquired infection. Answer is B. Nosocomial infection means at the admission of time when that patient is not having any signs and symptoms of infection. After 48 hours of post admission, any infections is occurred means is called as hospital acquired infection. hospital acquired infection. This is called as nosocomial infection. This will be happened in hospital only. That's why called as hospital acquired infection. Next, sixth question. In sixth question we can see in micro drip set 1 ml intravenous fluid how much? And they asked in sixth question in micro drip set 1 ml intravenous fluid how much? A 15 drops, B 60 drops, C 45 drops, D 25 drops. 1 ml equal to 60 drops here. Micro drip set. Micro drip set looks like JMS set only, IV set only. In hospital, some of the doctors will advise some specific medicine conditions. For example, heart patients or kidney patients also. They will advise according to weight and height of the patient. They will advise micro drip set according to drops 60 ml per hour or 60 drops per hour. Like this some doctors will advise. In hospitals some patients calculation according to patient weight. And next move on to seventh question. Excessive sweatings is called as what? A palpitation, B percussion, C perspiration, D all of the above. Sweatings means here answer is C perspiration. Answer is C perspiration. Actually perspiration means exercise. This is the cause of exercise. When someone is doing exercise, speed of the heartbeat will automatically increase. That time automatically sweatings will come. One more thing, when person feels stress, that time also automatically sweatings they will get. Answer is perspiration, C. Next move on to 8th question. What is the arrhythmia? A. Irregular heartbeat, B. Irregular respiration, C. Abnormal body temperature, D. Abnormal blood pressure. In question only is there arrhythmia. Arrhythmia means the rhythm. In question only rhythm. Rhythm means heartbeat. Answer is A. Irregular heartbeat. In this question only is there rhythm means patient related to heart rate. We can see in ECGs and monitor also. When patient is connected some monitor, that monitor heart rate will come rhythm. In rhythm the irregular heartbeat rhythm is called as arrhythmia. In medical term irregular heartbeat is called as arrhythmia. Okay friends, next move on to 9th question friends. The 9th question is the sequence of nursing process. What is the sequence of nursing process? Options: A. Nursing diagnosis, assessment, implementation, evaluation. Option B. Evaluation, diagnosis, implementation. Okay friends, next option C వచ్చేసి assessment, nursing diagnosis, planning, implementation, evaluation. D. Option D. Planning, nursing diagnosis, assessment, evaluation. Option C is the correct answer here. Assessment, we have to assess the patient. Next we have to diagnose the patient. Then we have to plan and implementation of the plan, and after implementation we have to evaluate what outcome. Actually nursing process is the only we can provide sufficient care to the patient. According to this process only nurse can achieve approximate goals. According to this nursing process, assessment, nursing diagnosis, we have to diagnose the condition, then we have to plan what is the condition, how we have to give a care to patient, then we have to implement that planning, then evaluation will be finished, means outcome will come. This is the sequence of nursing process. Okay friend. Next, 10th question. The 10th question in this question paper is kidneys. Kidney is present in options. Option A, lumbar region. Option B, iliac fossa. Option C, lower abdomen. Option D, epigastric region. Option A is the right answer friends. Lumbar region. Lumbar region means actually the right kidney lies between the first third of lumbar vertebrae. That's why it is situated and presented lumbar region. Actually right of the kidney, one first and third lumbar vertebrae position is situated in here, first and third lumbar vertebrae, and approximately length is 11 centimeters. Kidney length is 11 centimeters, width is 3 centimeters. Okay friends, approximately 11 centimeters length and width is 3 centimeters. Lumbar region is the right answer, A. Okay. Next, 11th question. 11th question is length of female urethra. The length of female urethra. Option A 2 centimeters, option B 4 centimeters, option C 10 centimeters, and option D 7 centimeters. Here answer is option B 4 centimeters. Actually 4 centimeters. Why 4 centimeters means actually most common cause is decreasing the length of the urethra is UTI friends. Urinary tract infections is one of the most common cause for less length, decreasing length in female urethra friends. Urinary tract infection is most common cause in females comparing to males. This is UTI is most common, will occur in females most commonly friends. Next, 12th question. 12th question is choose the group of only upper limb bones. Choose the group of only upper limb bones. The options here: A, humerus, tibia, femur. Option B, humerus, radius and ulna. The option C, femur and humerus. The option D is femur and radius and ulna. Option B is humerus, radius, ulna. Actually humerus, radius, ulna is the upper limb bones. You can see radius, ulna is present in hand. You can observe here options. Humerus, radius, ulna is the answer. Other options is there. Here femur, radius. Femur means here present in lower limbs. Tibia is present in lower limb. That's why. Okay friends. Next, move on to 13th question. The 13th question is renal threshold for glucose. The renal threshold for glucose is A. Option A 200 mg for DL. Option B 180 mg for DL. Option C 360 mg for DL. Option D 600 mg for DL. Answer is B friends, 180 mg for DL. Here actually threshold of the glucose means the glucose level in kidney. Okay friends, renal threshold for glucose 180 mg for DL is the correct answer. That is B. Option B is the correct answer for renal threshold for glucose, means the glucose levels in the kidney. Okay friends. Next, on to 14th question. 14th question. Which one is an acid fast bacilli in options? Option A Mycobacterium tuberculosis. Option B Streptococcus pneumonia. Option C Staphylococcus aureus. Option D Salmonella typhi. The answer is A friends, Mycobacterium tuberculosis. The answer is Mycobacterium tuberculosis. Actually, mycobacterium tuberculosis is present in blood in lab test. That is a positive means patient is having tuberculosis. Okay friends, actually acid fast bacilli we study in Nelson method. Okay friends, Nelson method. Here answer is A, mycobacterium tuberculosis. In blood test, the mycobacterium tuberculosis is there means present means actually person is having TB, tuberculosis. Okay friends. Next question is 15th question. The term hypertrophy means increase of what? Here options is A, osmotic pressure, B, cell number, C, cell size, and D, intracellular fluid. Actually hyper means more. Okay friends, hypertrophy. Here answer is cell size. For example, the example for hypertrophy is a benign prostate hyperplasia hypertrophy friends. Here benign prostate hypertrophy means the increasing size of the prostate gland. Friends, here B option cell number means hyperplasia. Don't confuse friends. Hyperplasia means cell number increasing cell number. Next, hypertrophy means the cell size increasing the cell size. Example BPH, benign prostate hypertrophy. Okay friends, next move on to 16th question. Pulse is checked routinely before administration of what? Before we are administering some medicines, we have to check pulse. That is the major thing. Examples are A, NSAIDs, non-steroid anti-inflammatory drugs, B, beta blockers, C, diuretics, and D, ranitidine. The answer is NSAIDs, non-steroid anti-inflammatory drugs. Why? Okay friends, actually these medicines are increasing the heart pressure means heart rate and may occur heart attack and stroke. That's why we have to monitor pulse of the patient before administering the NSAIDs drugs. Okay friends, be careful with this NSAIDs drugs, and before we have to check the pulse of the patient and monitor continuously closely, because heart attack or brain stroke will occur with NSAIDs drugs. Okay friends, next we can see 17th question. 17th question is treatment of what is the treatment of tuberculosis? HRZE is what? Tuberculosis medicines friends, don't confuse. HRZE. Options here. Option A, isoniazid, rifampicin, pyridine, ethambutol. Option B, isoniazid, rifabutin, pyridine. Option C, isoniazid, rifampicin, pyrazinamide, and ethambutol. Option D, all of the above means A, B, C. Okay friends, actually answer is C, isoniazid and rifampicin and pyrazinamide and ethambutol. These four medicines we can treat tuberculosis. Okay friend, these are four medicine options. C is the answer, isoniazid, rifampicin, pyrazinamide and ethambutol. These are four medicines we can treat of tuberculosis. Here this medicine is also called as HRZE. HRZE means option C. Friends, next here we can see the 18th question. Friends, 18th question. Sorry for the delay friends, actually here 18th question we are getting now next. Okay, 18th question is monitoring of urinary output is important, especially while patient care getting what? Monitoring of urinary output important, especially patient is care getting Option here A Lasix, B magnesium sulfate, C digoxin, D A and B means Lasix and magnesium sulfate. Actually Lasix is a antidiuretic, can use in antidiuretic medicine. Answer is D, A and B is the answer, Lasix and magnesium sulfate. We can use these medicines in especially cardiovascular diseases, friends. Magnesium, low magnesium levels is there means here they will correct like this. In 19th question, next move on to 19th question, the drug of spironolactin is A carbonic anhydrase, B osmotic diuretics, and C potassium sparing diuretic, D is diarrhea. Actually C is the correct answer, potassium and sparing diuretics. Actually spironolactin used for to treat a high BP means high blood pressure patients and heart failure patient. This medicine can prevent heart stroke and brain stroke. Heart attack patients and brain stroke patient can use this tablet means medicine drug spironolactin. Answer is potassium sparing diuretic. Okay friends, it is used for patient treat with high blood pressure and also heart failure patients also. Next 20th question, oral anti-diabetic drugs is commonly used in which condition? Type A, and option A is type 1 diabetes, option B type 2 diabetes, C type 1 and type 2 diabetes, D is none of the above means there is no answer. Actually type 2 diabetes mellitus means type 2 diabetes is oral antibiotic means antidiabetics means oral medications helps to manage blood sugar levels. It here we can help to involve moderate changes in lifestyle and dietary modifications. These both here we can use friends with the type 2 and type 1 diabetes mellitus. These are the medication help to manage the blood sugar levels in the body and we can decrease the sugar levels in blood, moderate changes in lifestyle. The question number 21, what is the full form of CVA? Option A cardiovascular accident, option B cerebrovascular attack, option C cardiovascular attack, and option D cerebrovascular accident. Here option D is the correct answer, cerebrovascular accident. Actually this is one of the central nervous system disease. Interruption in the blood flow into the cells in the brain. The cerebrovascular accident will occur. It is also called as brain attack also. The interruption in the flow of the blood to the brain cells. Okay friends, next question number 22, Hodgkin lymphoma. What is Hodgkin lymphoma? Here options A cancer of lymphatic system, option B HIV infection, option C is bacterial infection, and option D is fungal infection. Actually this is the part of cancer means immune involved in the immune system also. Here question only is the lymphoma. Lymphoma means it is the type of cancer that affects the lymphatic system means cancer of lymphatic system. Answer is A. This is affects in the lymphatic system and also involved in the immune system also. So answer is A, cancer of lymphatic system. Okay friends, next you can see, move on to question number 23, most common cause of lung cancer. What is the most common cause of lung cancer? Here options is A cigarette smoking. Option B, inhaled toxic agents. Option C, consumption of alcohol. And option D, B and C. There is no doubt here. Lung cancer means cigarette smoking, cause of cigarette smoking. Here is the correct answer. Actually, here option C, consumption of alcohol is there. Actually, is consumption of alcohol the most common cause of liver cirrhosis of liver. Friends, actually cigarette smoking is a common cause. All of you know about no need for explanation also for lung cancer. Actually cigarette smoking is the most common cause. Next, move on to 24th question. Responsible genes for breast cancer. Option A, BRCA1 and option B, BRCA2. C, A and B means A and B. D, none of the above. There is no answer here present. Answer is A and B, friends. BRCA1 and 2. These both are common cause for genes, responsible genes for breast cancer. These are the hereditary cause for breast cancer. Actually treatment is surgery and radiotherapy and chemotherapy. We can control the breast cancer. This is the most common condition in females. Breast cancer is the most common in females. Next, 25th question number 25. The drug of choice for hypertension. The drug of choice for hypertension. Options A, proton pump inhibitors. Option B, CNS stimulants. Option C, ACE inhibitors. And option D, vasopressors. The answer is ACE inhibitors, angiotensin converting enzyme. ACE means angiotensin converting enzyme. Actually drugs here we can use for hypertension control: perindropil, captopril, fosinophil. These medicines we can use under ACE inhibitors to control the hypertension. Next, move on to 26th question. A patient with tricuspid valve disorder will have impaired flow. Here, option A, superior vena cava and right atrium. Option B, left atrium and left ventricle. Option C, right atrium and right ventricle. The option D, right ventricle and pulmonary artery. Actually tricuspid valve, this is present in between the right atrium and right ventricle, friends. Actually blood flow means blood flow comes from the tricuspid valve in between the right atrium and right ventricle. Answer is option C, right atrium and right ventricle. Here this is the one of the type of heart valve disease. Actually tricuspid valve disorder is one of the type of heart valve disease, and this is occurred impaired blood flow from the two right heart chambers. Means here right heart chambers are present here in options right atrium and right ventricle. Difference. Next, question number 27. The commonest signs or symptoms of obstructive jaundice. Okay friends, commonest sign or symptoms. Option A, clay colored stool. Option B, dark urine and stool. Option C, pyrexia with raised blood pressure. Option D, elevated urinary urobilinogen. Elevated urinary urobilinogen. Answer is clay colored stool. Actually answer is clay colored stool. In this condition, normal drainage of bile from the liver to the small intestine is blockage. Means in this condition means obstructive jaundice. Obstructive jaundice only, here it is the obstruction. Some obstruction of drainage bile from the liver to small intestine is blocked. That's why the color of stool automatically will change, means clay colored. Next, question number 28. What is dementia? Means dementia defined as option A, loss of memory, option B, loss of hearing, option C, loss of appetite, and option D is loss of vision. Actually, dementia is one of the psychological condition. Dementia is a group of condition characterized by impairment of brain functions. Any two brain functions. Here option A is the correct answer, loss of memory. It is the one of psychological disorder. Two characteristics means this group of condition the patient will impair with two brain functions. Okay friend, option A is the answer, loss of memory. Option A. Next, 29th. In question number 29, endolymphatic hydrops is a what? Here options is inner ear disorder, option B middle ear disorder, option C outer ear disorder, option D disease of lymph nodes. Here answer is inner ear disorder. Option A is the correct answer. Endolymphatic hydrops is a condition of increased hydroiliac pressure in the inner ear. Okay friends, this is one of the condition, increased hydroiliac pressure in the inner ear. That's why inner ear disorder. Right. The option is A. In this video, last question 30. 30th question is dryness of conjunctiva occurs due to deficiency. Means the dryness of conjunctiva occurs due to which vitamin deficiency? Option A vitamin A, option B vitamin K, option C vitamin C, option D is the vitamin D. Actually most common causes for eye disorders is vitamin A deficiency. In eye problems, main cause is vitamin A deficiency. Vitamin A and important thing is vitamin A serves several essential functions to the eye friends. Next question 31st to next further questions I will make a part 2 video friends. Thank you for watching. Please subscribe my channel. Click on the bell icon for further notifications. Thank you for watching friends.